Welcome to those of you who are joining on the Geneva Learning Foundation social media platforms. I'm Rida Satki. We'll be starting with this, kicking off this special event in just over 3 minutes. Stay tuned, stay right where you are, make yourself comfortable. If you are on Facebook, LinkedIn, or YouTube, share your messages. We are reading every one of your comments and we'll be able to share them on screen, just as you're going to see here. So Steve Mwangi from Nairobi, Kenya, just introduced himself. He's connecting from Facebook. Warm welcome to you, Steve. We'll be starting in just under 3 minutes. And the same, Adeoye Kayode from Osun State, Nigeria. A warm welcome to you. You're also connecting from Facebook. Wherever you may be, whatever time of the day or night, we want you to feel welcome here, to feel that you are part of the global immunization family, and we'll be kicking off the event in just over 2 minutes. So see you soon, and we're really looking forward to this event. I've been counting down the days and feeling the anticipation and the excitement build up, and we're eager to hear your voices. This event is going to be about you, about your challenges. Before we talk about the strategy for 2030, we wanted to start with people who do the work daily of delivering vaccines, because it starts and at the end of the day, success or failure will rest upon what you do, and not only what you do but also your leadership. We'll talk more about that in just under 2 minutes. See you soon. Warm welcome to all of you from Geneva, Switzerland. I'm Rida Satki from the Geneva Learning Foundation, and we're here to contribute to the kickoff of the Immunization Agenda 2030, the world's new strategy to achieve the immunization goals. So many people in the room, then I want to warmly welcome all of you. Most of you, or some of you, may know that the Geneva Learning Foundation has been working in the field of immunization now for over 5 years. Working together with you, we have built the largest platform of immunization professionals. You can see here the social networking analysis showing how not only have we been sharing information with you, doing things, offering things to do with you, to collaborate, but you have been learning to collaborate together in new ways through digital networks. And that is what we're excited about today. 4,769 immunization professionals had confirmed their registration. I can see there's still a lot of people flowing into the Zoom room. There's also a very large number of people watching across our social media platforms. Very important and very significant. We invited global and regional partners, and 59 responded and confirmed their support. That is very important. We want, if immunization professionals are invited to share their challenges, we want to make sure that there are partners from the global and regional levels who are here to listen and also to share their feedback and their thoughts as they have been. They are the key stakeholders and ultimately accountable for the Immunization Agenda 2030 strategy. Now, this event, as you'll see, is built around the challenges that you are facing, and 1,847 challenges were submitted by immunization professionals ahead of this event. You can see 941 in English and 906 in French. The English language event will be happening tomorrow. Before I go any further, I want to introduce actually the mistress of ceremonies, Charlotte Mbou of the Geneva Learning Foundation. It is Charlotte who has done the work, working with dozens, hundreds, perhaps more of you who have been to prepare the presentations you're going to hear today, to prepare the to share with you. And I'm going to bring her up on the screen now. Let me just, yes, because she does have, yes, here we go. A warm welcome to you, Charlotte. How are you doing? What are you feeling right now, seeing hundreds of people from all over the world, immunization professionals like yourself, getting ready to share these challenges?
Thank you very much, Reda. It's with great excitement that I'm actually here today, having this wonderful opportunity to get to listen to the authors of the various challenges that we shortlisted, just to say that there were so many challenges that were, as an immunization professional, are quite identified with. And I think that the sample we are going to get today, many in the room, many who are watching via a social media platform will be able to identify with this. But I'll be most delighted to really hear from them what they are doing about this, and hopefully what the Immunization Agenda 2030 will have to offer them to enable them to address these challenges, Reda. So, and I really want to thank those who responded to our invitation to join this event today.
Wonderful. Thank you very much indeed, Charlotte. So here you can see up on the screen, let me put it back for people who are in our Zoom studio, let's say. Here are the questions which the challenge owners will be answering. So of course, we'll first ask them to introduce themselves. We'll ask them, what is your challenge? We have short summaries that we'll be showing on the slide, but even better to hear directly from them. Why do you care about this challenge? Why does it matter? What are you doing about it? And then, and this is the relevance and the significance of partners being in the room, is what support do you actually need to tackle this challenge? What are the barriers that are preventing you from making progress? If you have a resource challenge, well, imagine you had all the resources that you needed. What would remain in terms of barriers? And then, because we're talking about Immunization Agenda 2030, and I know this may be difficult, you're dealing with a daily work and there's so many urgencies, but we actually want to ask you, we want to know, what do you think success looks like for the global community in 2030? And I apologize for the spelling and grammatical mistakes. We are also in a hurry. And then last of all, as you listen to these challenges, if you're a participant in the room, ask yourself, do you face this challenge in your context? What are you doing about it, and what support do you need? So I'll be pulling these questions back up for the presenters. Now, over to Charlotte, so we can hear what is your first, challenge owner. Where are they from, and what are they going to give us a teaser of what we're going to hear about?
Okay, so thank you very much, Reda. And if you could just pull up maybe the slides, I'd like to invite Jo Andreas Ateke, that's from Cameroon.
All right.
So if you can just unmute yourself, Andreas, and then we'll start with your story. So I see he's in the room, and you've been invited to unmute.
Okay, thank you so much, Charlotte. I'm sorry I had a little challenge with my internet access, so I couldn't follow at one point, went off to reconnect with another network. So I am Joe Andreas, the Deputy Manager for EPI Cameroon. So a post I've been working in for just a month. Before this time, I was working in the Southwest region of Cameroon as the Regional Manager for EPI. So my story is about with the onset of the conflict in two regions of Cameroon, Northwest and Southwest. There was a great fall in the vaccination coverage of all antigen within the previous 4 years. In the previous 4 years, with vaccination coverage getting to less than 50 in 2019 in the affected zones. This exposed the population to vaccine-preventable diseases. With this observation, we called for help from experienced staff and also from several organizations with skills in crisis during the meeting with the regional and local and international actors. I also took online courses on humanitarian response in conflict and disaster, and also courses on reaching every community. We have organized several rounds in periodic intensification of routine immunization in several health districts of the affected region through the use of community health workers to help penetrate the site. We realized that the use of these community actors that are based in the affected communities help us to vaccinate more than 80,000 missed targets in 2020 in these two regions. However, the cost of the period is very high, and we wonder how sustainable this will be. We were, of course, surprised by the fact that Piri helped us gain more than 15% points, 28% the Southwest, 5 in the Northwest, in 2020 in these regions, over 12 months, regardless of the persistence of insecurity, even COVID outbreak. Today, we are looking for more innovative approaches and skills to help sustain the current achievement and to improve in our indicators. Thank you.
Thank you very much indeed, Njoateke. Andreas, let's go back to the questions, and I want to would like to ask Charlotte: are there any questions, follow-up questions that you'd like to ask, so we can really understand the significance of this challenge? And then for participants in the room, ask yourself: have you faced? There's actually a number of challenges in what is in some ways a wonderful story of actually reaching certain results. Please share in the chat. And also raise your hand if you'd like to respond to this challenge. Charlotte? Okay. All right, Charlotte seems to be, okay, so it looks like Charlotte had the inevitable connection problem. So thank you, enjoy it. Let's go to our next presenters, and we'll wait for Charlotte to rejoin. And of course, this is part and parcel of connecting in these new ways. I want to acknowledge, take this pause to acknowledge many people. The room is now at its maximum capacity of 500 participants. We know with many more people, we have opened up that. This is why we're live streaming on the social, on our social platforms. So on Facebook, YouTube, LinkedIn, just look for the Geneva Learning Foundation. I want to take this time now to greet Okoyen Ebika Paye, who says regards. Dr. Okoyen, we'd love to know what city and country you're connecting from. Robert Ninsen from Gambia, working in South Sudan, happy to be part of this great initiative. Wisdom, who is joining from River State in Nigeria. Great to see the Nigeria Scholar team here today. Nasir Omar, who says good afternoon everyone from Katsina State. Johnny Castro from Cameroon, who's a public health expert and intern, malaria and the EPI program. Bariani Gariba, who just says hello, and that is fine too. Amel El-Taher connecting from the Kingdom of Saudi Arabia. Habib Idris from Cameroon. Abdi Jamal from Kenya. Jonathan Kisi-Perbang from Ghana. I'm not going to be able to greet everyone, obviously, but I will. We want to acknowledge so many of you are joining. And beyond saying hello, please share your responses. You heard this challenge. Is this your challenge too? Do you recognize yourself? Did you hear something that's where you said, okay, there is a common thread here. We are all facing many of the same challenges today. All right, and I see Charlotte is still not back. She's sending me, let me just see. All right, she's having connectivity issues, and that happens. Let's go to Joanne Ejambi. Let me see if we can, yes. So Joanne, I've asked to unmute your microphone. Yes, and let's go to your challenge. So let me quickly summarize what you called repentant immunization defaulters, and help resolve non-compliance by sharing their experience. So during a measles vaccination campaign, you met women who defaulted, and you learned from them that they had concerns about nursing a child from the side effects of fever. And you ended up working together with them on sensitization, resolving non-compliance in the community. They became, you told us in your submission, your immunization champions, resolving non-compliance by sharing their experience. So on the screen now, Joanne, you see the questions, and we'd love to hear, just to have you go through them and share your thoughts. What are you, what have you done with this, being able to turn around quite dramatically people who were initially opposed, understanding their needs? What are the lessons that you learned from this experience?
Hi, everyone. Hello.
Yes, we hear you loud and clear, Joanne.
Okay, yeah. My name is Joan. I work at Ahmadu Bello University Teaching Hospital. That's a tertiary facility. I'm a consultant and medical microbiologist. I also am a FELTIP graduate 2017. So I supported Kaduna State, where I work, under the AFINET program to supervise the supplementary immunization activities for measles. So during the course of the campaign, I realized that most of the reasons people give for not completing the vaccination schedule for their children, either lack of awareness or the vaccination site being too far or having no faith in the vaccines, most of these were resolved by actually bringing the campaign to the community. But in spite of this, I noticed that the vaccination posts were not being patronized by parents. So I took the initiative of going from house to house to try and inquire what was actually the problem. So while I was at a house discussing with the mothers, an older mother there told me that she had realized from her experience, she was encouraging the younger ones that after vaccinating the older children and having to nurse them from the side effects of fever and pain, she felt the side effects were a bit too much for her to bear, 2 or 3 nights of not sleeping and all that. So for her younger kids, she ended up not fully vaccinating them. And they now came down with measles, especially. And she now realized that the cost, financial cost, because these kids, when they are severely ill with measles, apart from the skin manifestations, the respiratory tract infections, the high fever or convulsions, they require hospital admission. And if you are not fortunate, you might end up losing the child. So comparing her kids who are vaccinated from those that are partially vaccinated, she realized that the vaccines actually do help. So she encouraged the younger mothers around her that they should cash in on the opportunity and ensure their children are fully vaccinated. So using her as a volunteer and a champion in the community, when we had cases of people that had 0 vaccinations in their compounds or in their families, we asked her to go with us to help speak to these families and these mothers. And because she was from the community, she speaks the language, she's somebody they know, it was easier for them to understand and accept the fact that the vaccines actually do work and help to prevent severe diseases in children. So she helped us resolve a lot of long-standing cases of non-compliance in that community. So that's what I want to share. Thank you.
Thank you very much indeed. I'd like to ask you, even if you are sitting in front of your computer screen, to do something that may seem a little bit odd. If your colleagues don't know what you're doing, they may find it strange. But I'd like to ask you to put your hands together for our first two presenters. We wanted to start with stories where there are challenges, but there is also progress being made on the ground by immunization professionals. So if you could join me in... It may be odd, but we are 500 people in the room, and unfortunately we are at room capacity. So if you are trying to get in, we need you to move to the Facebook, YouTube, or LinkedIn pages where you'll be able to follow the event. And we see many people who are on the social media platform. So Mai Abdallah says hello to everyone from Egypt. Rizwan Asgar really shares the hashtag that matters is vaccines work. Imam Wadabelo from Kano, Nigeria says, great to meet you all. And Dr. Justice Mwesigiri from Uganda. Just a few of the people who have joined us in the past few minutes. I do want to highlight, Pamela Ambe says, it's the same challenge. I am Pamela from Cameroon. It is not easy because of the conflict in the Northwest and the Southwest. Thank you, Pamela, for sharing that. And we encourage you, once you've said hello, you've said what country and city you're from, do tell us more. Do tell us what your thoughts are as you listen to these challenges. I see many hands raised. I'd like to ask you to focus your responses on what you heard, what you heard in the first two challenges. We're going to hear from Dr. Khalid Abu Bakr. Let me see. There's so many people in the room at any one time. Yeah, I'm trying to. All right, here we go. Yeah, Dr. Khalid Abu Bakr, we would love to hear from you, as well as, yeah, if you're able to unmute yourself. All right, we'll come back to you, and I do want to check if Charlotte is back in the. Okay, yes, is that?
Yeah. Sorry, this is Dr. Uday Bodhankar from India. The greatest challenge which we are facing. I'm thankful to you for bringing more than 500 stakeholders on single platform. I never heard of this in my life. Grateful to you and your organization. Greatest challenge which we are facing today is the COVID vaccine challenge, advocacy, equitability, and the distribution. And for this, I would request all the stakeholders to help all the Asian countries, African countries, or developing countries to help to have equitable access to vaccine, to medicine, to oxygen, and to the beds and ventilators. This is my take-home message. Thank you very much, Dr. Uday from India.
All right, thank you very much indeed. All right, let's go to, so Charlotte is still unable to reconnect, and this is part of our daily experience. It's and we know that there are many of you who will be catching up on the recording precisely for that reason. I'd like to go to our next presenter, who is Syed. I am a bit sad for Charlotte because she is the one who did most of the significant work to prepare this event. So let me see. All right, let's go to Vinay Bai. Let me see if Vinay is in the room. All right, and then Fahad Femi from Pakistan. Let's go to Kabir Ado. Yes, all right. So Kabir Isa Ado, I've asked you to unmute. Are you able to speak? And let me first of all introduce the challenge that you shared. So
go ahead.
All right. So, Kabir, you're also from Nigeria, and you submitted this as research and innovation, and you said that you were involved in a focus group discussion capturing community perspectives and risk communications of COVID-19 and vaccine hesitancy in northern Nigeria. So this was in the context of a research partnership. And you say the outcome of the research is shocking. And we hesitated because there are sensitivities and sensitive issues, whether we could or should share this. You said majority of the people you worked with are really negative about the existence of the pandemic in Nigeria. So, of course, we're talking about vaccine hesitancy in a kind of extreme form. And you said we need a serious campaign and advocacy. Tell us more.
Yeah, my name is Kabir Isa Ado. I'm infodemic manager consultant from the first training conducted by World Health Organization, WHO, for infodemic management. And I also work as a volunteer with Global Immunization Action Network Team, Giant, Nigeria, as a regional director, Northern Nigeria. And our main vision, we are working to improve global public health outcomes by combating vaccine immunization hesitancy through effective, sensitive, science-based communication and education. We recently conducted a research in partnership with Giant on COVID-19 vaccine immunization hesitancy in some part of northern Nigeria. I think it is on 1st April. We conducted the research in Kazaure, Jigawa State. It's a focus group discussion related to the vaccine immunization, but the outcomes of the research is really shocking, because majority of them, their beliefs are negative related to the pandemic existence.
I understand. And so, Kabir, my question for you then is, what are the barriers to make progress? What support do you need to tackle this challenge? Of course, there's a lot of awareness and a major commitment from the global immunization community around vaccine hesitancy. What do you need? What will make the difference for you?
We need a serious campaign and advocacy awareness related to the vaccine immunization at the region by involving medical practitioners, community traditional leaders, religious leaders, youth leaders, celebrities, women leaders, and through the Women Islamia in school, in order to create awareness and also educate and explain fully that the pandemic is real, and also to show them the danger or the risk of running away to the COVID-19 vaccine immunization, which become one of the worst pandemic in the history of the world. We need that support. And the main barriers are to make people aware and accept the COVID-19 pandemic is real. By doing that, people will rush for the vaccine immunization and follow all the rules related to that.
Thank you very much indeed. Now we have another challenge that was submitted by Mohamed Kaba from Senegal. And I'd like to turn to Mohamed so he can tell us about this challenge, the one that you see on screen. And then I'd like to really welcome very warmly and introduce Anne Lindstrand from the World Health Organization and Robin Nandy from UNICEF, and ask them for their initial thoughts about what they're hearing in these challenges, but also the way progress is being made in the few countries that we have heard from so far, knowing that we have 14 more challenges. We may not get to all of them today. Mohamed Kaba, welcome. You are from Senegal and you shared a challenge about addressing, again, false rumors and vaccine hesitancy. And you say you had a strategy, communication starting from the highest level, and then you said that you had a lesson learned. So can you tell us what was the lesson learned, and then what, again, the same question, what do you need in terms of support to tackle the challenges that you're facing around false rumors about vaccines? Mohamed, first of all, welcome. All right, I see, Mohamed, you're unmuted. I'm not hearing you yet. So please check your microphone. And let's see, we have many incoming messages. So while Mohamed, let's see if Mohamed can fix the communication problem. We have some great comments coming in from the social media platforms. All right, this one I will share. It's, vaccines work. However, there is, according to wisdom, neglect from mothers in completing their children's vaccination, probably due to lack of knowledge of eventual benefits. If there's anyone who'd like to respond to that. All right. And let's see, Emmanuel Apanga, who says, it's amazing to be part of this program. The world is at a crossroads with COVID and sustaining immunization coverage and global health public interventions. Thank you, Emmanuel. Let's now go to ask to introduce Anne Lindstrand. And all right, let me see. Yes, and Robin Nandy, I'm asking you both to unmute, and we'd love to hear from you. If you are able to turn on your webcams, we'd appreciate that as well. If you could first introduce yourselves and just an initial response. What are your thoughts about this gathering of literally thousands. There's 500 maximum capacity in the room. Immunization staff who've begun to share their challenges and really rallying around Immunization Agenda 2030. Shall we start with Anne?
Yeah, first of all, it's super encouraging to see this energy in the room. And at the start of this decade, IA 2030, see this commitment that we all care about immunization. To this week, it's the World Immunization Week, but we've also launched a new strategy for the World Immunization Agenda 2030. As you know, where we all are committed and as to the success of life-saving immunization. And as the voices I've heard so far really emphasizes that we are at a pivotal time. Emmanuel was saying this is a moment in time when we see immunization can take us out of this pandemic. I just wanted to say that when I heard Joanne, you're talking about the child that comes home with fever and the discussions of how to, respectfully meet her in the worry and be able to respond to the worries and explain in good words that the mother understands and can take to her heart the beauty of science as a medical intervention that can actually save life and keep us safe and keep our societies prosperous, and how you in the dialogue try to give the science, but also understanding and showing empathy for the worries. I think that as Kabir was saying, we are facing many misinformation, questioning of immunization, but I think that the world will actually, during this pandemic, come out much stronger in the support of immunization. We will see the effect on the pandemic that will bring us closer to everyone we love. But mindful, I see Robin is speaking. So I leave over to you, Robin, to give the comments on the routine immunization programs, because we do care and are very worried that the effect of the pandemic and the rollout of the COVID-19 vaccine will also have an effect of the childhood immunization program, which we all care about. We don't want the children to pay the price for fighting this pandemic. Over, Robin, to you.
Thanks, Anne. Hi. Anne, you didn't introduce yourself, but Anne is from WHO, and I'm Anne's counterpart at UNICEF. Sorry, Anne, go ahead.
Yeah, you can see it up in the air. I'm from WHO.
And I'm UNICEF's Global Chief of Health. No, this is a fantastic gathering. I'm really happy to be a part of this. And just to add to, and I know I have to be brief because of time, because we want to hear from you today. We don't want to speak at you. We really want to hear from you. But just to add to Anne's a summary is we understand the challenges that you all are facing. The challenge in terms of responding to COVID-19, also the delivery of COVID-19 vaccines, but in parallel to keep routine immunization and other essential services going. And, we are at a global level putting this message out very clearly that essential services need to be independently planned and resourced and delivered in parallel to COVID-19 vaccine. As more vaccines become available for COVID-19, most of your countries do not have an adult vaccination program and will be dependent on the childhood vaccination program, your capacities to deliver COVID-19 vaccine. And we don't want further disruptions after the disruptions that we have faced in 2020 that you all are very aware of. The other thing that I would, I would really, say is that, we have to also tease apart the dynamic that we are facing at ground level. 3 or 4 of the challenges were around vaccine hesitancy and vaccine perception. And I think it's really important that we are extremely focused and sophisticated in how we address it. I hear a lot of vaccine hesitancy word thrown around. We need to actually go deep. It's like peeling an onion. We've got to really understand what the root cause of the problem is. For example, vaccine hesitancy to COVID-19 vaccine is very different from vaccine hesitancy to existing childhood vaccines. For a number of reasons. COVID-19 vaccine is a new vaccine under emergency use authorization. It is targeting primarily adults. So there are a lot of differences here. And I think we need to really tease apart. Convincing an adult to receive a vaccine is very different from convincing a parent to vaccinate their children. And you talked about threat perceptions and so on. And then finally, the question on PDs. I think this discussion is hitting on some fantastic points. How are PDs to be sustained? How do we improve cost effectiveness of PDs? And I'm really stimulated by these, because these are exactly the questions that we need to ask ourselves. PDs are meant to reduce dependence on campaigns, and I suppose the way we look at cost efficiencies, the more services that we can deliver during the intensification of routine, it makes it more cost effective. And that's the spirit of IA 2030. We don't look at immunization itself independently, but as an entry point to primary health care. That's really important. We are approaching it in a more horizontal manner than traditional immunization vertical program.
Thank you so much, Robin Nandi, and as he said, his counterpart from the World Health Organization. So Robin Nandi is at UNICEF, working at the global level, and Lindstrand is at WHO. We're really grateful that they are taking time out to come here and listen to some of the challenges. A few, as we said, of the 1,847 challenges that were submitted by you and that we'll be sharing also with global partners. There is an increasing number of people who are still joining the event and sending messages. I'm sorry that we cannot acknowledge everyone, because we'd really like to go to the next challenge. And I'm going to turn to Aishwarya. You'll correct my pronunciation of your name, from India, who has a challenge about coverage and equity. So let's look here. It's about reaching migrant communities with immunization services. Aishwarya has observed people migrating to big urban areas. The children who move along with their parents are missed by the system. To ensure equity and hence health security, we need to have a system that allows the poor, especially in the migrant communities, to come forward and receive immunization and other health services. This requires coordination and training. So Aishwarya, please do introduce yourself. You can see the questions up on screen. We've got a sense of your challenge. Feel free to add any details that will help us understand what you're facing. Really what we want to hear is, what support do you need to tackle the challenge? What are the barriers that are preventing you from ensuring that these migrant communities are accessing immunization services? But first of all, a warm welcome.
Hello?
Yes, we hear you loud and clear.
Thank you very much. My name is Dr. Aishwarya. I am a surveillance medical officer. I am working with WHO and PSP. As you projected, the issue that we face in the area that I work is that a large number of people in search of their livelihood, they move to big urban areas which may or may not be in the same state. So the children, the youngsters, are also taken by their parents to their place of work, and at these places, these children are either totally left out or they drop out from the immunization services. And these children often face the brunt of VPDs, vaccine preventable diseases. And this is in fact a great equity issue which can have repercussions in terms of increase in the incidence of vaccine preventable diseases, and also increase ultimately going in for child mortality, which is preventable. we need support in terms of because most of the migration is happening to big urban areas, big metropolitan cities. The support that is required to tackle this challenge is an increase in the human resources in both field workers who would actually immunize and also supervisory cadre. The second issue, which is a barrier, even if we had adequate human resources, is at the demand side. That is, many of the parents are unaware that their children need to be vaccinated, and the demanding generation would require a constant community mobilization. This can be done in our area because what we are facing is an out migration, that is from the rural area. The beneficiaries are moving out. We train our health workers to constantly follow up the children to see whether they are there in their resident villages, and whenever they come back, we try to vaccinate these children. Apart from that, we utilize surveillance data to look at any pockets of vaccine preventable diseases, which also help as a supplementary data to strengthen immunization. Thank you.
Thank you very much indeed. Let me ask you this question. So this is what the challenge that you're facing now. Are you able to imagine what things look like in 2030? So 9 years or so from now, what does success look like? If you're able to reach these migrant communities, what's going to be different? And what would you need to achieve that success?
For me, the success would look as a strong immunization system, which gives equitable access of service to all the entire population of the globe, especially a strong system in urban areas where they are able to reach out to the last child, do high-risk area mapping, and do mobilization.
All right, thank you very much indeed. Let's have a round of applause for Aishwarya from India, who just shared her challenge. And I also want to feel like we should have a round of applause because Charlotte Mbu is back. And I'm so sorry you had connectivity problems so severe you weren't able to connect. It's also that our room is at capacity, and we have we have 500 people here, and most of you are actually watching through the social media platforms. Charlotte, how are you doing? Are you fully recovered? And are you able to tell us? I have as the next challenge, I have Sinta Yehu from Nigeria. Is there someone else that you'd like us to go to first?
Actually, Reda Sintayu, she's here and has actually been waiting for her turn. Just to say I'm fine and thank you for just continuing. I got the opportunity to follow on Facebook like those who are there, and it was quite great. I was on the point of leaving my own comments, and then I had access to the Zoom room. But it's glad to know that I wasn't able to have access because the room was full to capacity, knowing the interest that immunization professionals have with regards to this particular subject matter. So I'd just like to invite Sinta Yeo, and you please forgive us if we are not getting your name right. So over to you. Reda, please, can you share her slides?
So community involvement in immunization activities is what the challenge is about. I noticed that most outreach sessions are not held as planned, and then there are 3 reasons why. So please, Sinta Yehu, a warm welcome to you. If you could share with us what those challenges are, and then address the questions that you see on your screen. Really, we want to know, to better understand, what is this challenge you're facing, why does it matter, and then what support would you need to be able to tackle it in the best way possible from your perspective?
Okay, thank you, Reda, very much. My name is Sinta Yehu Yeshana. I'm from Ethiopia, and I'm currently working for WHO Nigeria as a stop transmission of polio consultant and a public health specialist by profession. And currently I'm supporting accelerated activities to boost FP surveillance, including training of surveillance officers on facility-based and community-based active surveillance for FP, as well as investigation and follow-up of AFP cases. I also support routine immunization by building the capacity of health workers through on-the-job training, support outbreak investigation of vaccine preventable diseases, COVID-19 surveillance, and COVID-19 vaccine introduction. So the challenges I faced, I noticed in my field activity is immunization uptake is better in fixed posts than in outreach sites. Most of the outreach sessions are not being conducted as planned, and this is mostly associated with the shortage of budgets or inconsistent budgets allocated for transport, fuel for motorbikes for vaccinators, hence they will be discouraged, especially if outreach sites are far. And some health workers in local government areas that I'm supporting have only one health worker trained on routine immunization, and this health worker is expected to give all services. So if occupied with emergencies or other competing priorities, he or she will be obliged to cancel outreach sessions. Even for the our concluded phase 1 COVID-19 vaccination is the same set of vaccinators doing routine immunization who had been involved in COVID-19 vaccination. We did not have any additional human resource, so this is how the outreach are being affected. The other challenge is low community involvement on routine immunization due to the same incentive issue I described earlier. That is the village committee, development committee, or ward development committee members. They need transportation to come to health centers, or a kind of at least refreshment to come to health centers for meetings planned to improve routine immunization uptake. Also, the interviews made with health workers during supportive supervision revealed that the increased cost of transport, which happened after COVID-19 pandemic, is still there and is discouraging communities to come to outreach sites. So my role for this challenge is, together with my team, is to look for possible solutions for the shared challenges, like to make advocacy visit to Ministry of Health, State Primary Health Care Development Agency on the shortage of health workers in facilities, and sharing daily challenges faced during supportive supervision on our WhatsApp platform. We have a platform with WHO, UNICEF, Ministry of Health, and Primary Health Care Development Agency members, so as to be able to make action points for the gaps. We are also conducting meetings with PHC directors at local government area level, and we are liaising them with the local community leaders, chairman of the local government area, and make a kind of having local funds and again to gain the desired outcome by conducting the expected meetings with the village development committee members and allocating the desired resources for the outreach. So why am I'm proposing this activity is because the strategy has worked during the previous polio SIS. We were able to get a fully sponsored extra vaccination team for our polio campaign, and revaccinations we conducted in some local government areas by such advocacy visits.
Thank you so much, Sintayehu. Could you tell us what? Can you imagine if you keep doing the work, if it is properly supported, if you are able to overcome the challenges you're facing, what does success look like in 2030, nine or so years from now?
All right. Okay. So we are currently sensitizing, giving technical guidance to PHC directors, officers in charge of health centers, and we are giving on-the-job trainings on routine immunization. So I hope by 2030, challenge stories which we have been discussing now will be replaced by success stories, and each and every child in the world will be fully immunized.
Thank you, Sintayehu. Let's have a look at what is happening on the social media platforms. We have Mohammed Ibrahim, who says, regarding the migrant community, so referring to an earlier challenge, getting the communities to select community-based volunteers who will work as community mobilizers, connecting with the health workers, ensuring caretakers get adequate knowledge and understanding for subsequent doses of vaccines, tracking the missed children, reporting other related events. Steve Mwangi, who says opinion leaders at the local level are crucial gatekeepers of community entry points and instrumental to the success of Immunization Agenda 2030. Ismail Aidego, who says the issue of qualified health worker shortage in health facilities is a national phenomenon which cannot be tackled in the short run, hence may not be readily feasible in the short run. And Leo Dimudia recognized the challenge. We asked you, is this challenge that you're hearing, are you facing something similar? Are you facing the same challenge? And then thank you, Eric Amankwa, who says this is a very educative event. Great to be a part of it. Okay, and yes, you did tell us where you're from, Liberia. Mamfo Maferika says outreach is important to help reaching the unreachable. All right, so Charlotte, shall we be hearing from next?
Okay, Reda, I would like to invite Asobasi Joe Stephen. He's from South Sudan. So, Joe, if you are hearing me, please unmute yourself.
Okay, thank you so much. I'm Asobasi Joe Stephen from South Sudan. I'm immunization technical advisor working for JSI, supporting the Ministry of Health, and I'm also the national training advisor for COVID-19, supporting the current vaccine deployment in the country. The main challenge that we're facing in South Sudan is the challenge of persistent coverage, low coverage of immunization service for Penta 3 in the country. We asked for our DHIS report, it is only at 57%. And also we have got limited access points to routine immunization services, mainly serving the urban areas, leaving about 46% of the population unreached with the routine immunization services. So this has been the major challenge, and this challenge has been compounded by the conflict and the political unrest in the country that led to damaged healthcare infrastructure. We've got also a shortage of acute skilled staff to provide quality immunization services at all levels, including supervision. We have got a unique talent of geographical barrier, as in most of our areas are inaccessible by road. You need to airlift most of the vaccine supplies, drugs, and all this by air. About 70% of all these services are provided using air transport, and that increases the cost of providing immunization, and even a dose costing to more than $10. That is something very unique, and something that is happening in South Sudan. Apart from this, we have been seeing issue of mega budget allocation from a national budget, less than 10% going to healthcare service. And if you look at the country, more than 80% of all immunization program is financed by development partners. So you can see the level of financial support is provided. And why we are so worried about this challenge is that there is already increasing trend of zero dose in the country. As from 2017, 18, 19, and 20, this followed the outbreak of the war in the country. And of course, because of this, we have been reporting outbreak of vaccine preventable diseases, including the circulating vaccine-derived polio outbreak type 2, which was declared in the country last year in October. And as of now, we have 75 confirmed cases, including measles outbreak, which has been recorded in about 16 counties of South Sudan. Part of this vaccine is the vaccine preventable diseases contribute to about 17% of all total deaths in the country. That is about 10.7 deaths per thousand. Of this, 70% is coming from vaccine preventable diseases. So we have seen the impact of COVID-19 in this country. It has led to reprogramming of funds. Priorities have been changed, given that 80% of immunization program is financed by development donors. You find there has been a change in the focus in terms of resource mobilization. And we know vaccination is a foundation of primary health care. So what we have done about this is we responded in conjunction with the development partners and Ministry of Health. We conducted 2 rounds of polio campaigns using MOPV vaccine, including measles follow-up campaigns to cap down the outbreak. We've conducted the periodic intensified routine immunization to increase coverage, more especially in those hard-to-reach locations. And then we are continuing with the active surveillance. That's why we're able to report cases of outbreak and all this. In terms of the support that is needed, we are appealing to the government to ensure peace and stability in the country so that immunization services are able to take place without any interference, disruption. The support that is needed is also financial support, both from development and the government, from the domestic, financial resource mobilization strategies to put more funds for routine immunization in the country. There is a need for capacity building, more especially at the sub-national and the county level, so that the leadership in EPI are well equipped with the required skills and knowledge to deliver quality routine immunization service. There is a need to invest in the research. There is little information regarding immunization services, attitude, perceptions. So there is need to invest in the research to understand the actual magnitude of 0 dose in the country and how to improve. Stephen, and we understand the barriers, the peculiar barriers we have here is geographical barrier, insecurity, and road access. As I said, 70% of services are delivered by air. So the success for 2030, we are saying that by 2030, we should be able to have equitable immunization services so that children are able to have access to safe and potent vaccine by 2030. Over from me. Thank you.
Thank you very much, Stephen. What struck me was your last sentence in your challenge. Some counties performed well, while relatively peaceful counties reported low coverage despite increased investments in immunization. What kind of support?
Immunization coverage. So what is needed here is continued support supervision to continue, and also we need to ensure all immunization equipment are provided with the adequate financial support to ensure all health facilities are functioning. And that is it, because most of the immunization equipment are destroyed during the war, despite of the investment made to procure cold chain equipment and also to hire vaccinators.
Thank you very much, Stephen. Asobasi from South Sudan. We have many messages that have come in. Let me just pick a few of them. So we have, let me see. So first of all, we have a message from Ismaila Edego. I don't know if he's addressing you or someone else, but he says, sorry about the political unrest in your country, brother. This will also pass. And that expression of solidarity in a context where there are people from over 90 countries, I did want to highlight that, even if it's not directly related to immunization. Amedo Sali, who says it's a very important educative and basic lecture for population. Great, go ahead. Mait Ranki Kane, who says, my country conducted 2 mass immunization SIAs. We don't know what country that is, unfortunately, and please tell us if please add that in the comment. Uptake was suboptimal, especially in urban areas. Personal interaction with communities proved high community hesitancy due to lack of trust. Esther Amposa says transportation is a major challenge to reaching the goals of immunization. If this is looked at and health workers responsible for immunization are given the needed motivation, she did not complete her thought, but we can understand what type of support she is calling for. Mati Ranki also highlights in her country the fear that COVID-19 vaccine is being given, even though there is the COVID-19 vaccine protects from the coronavirus. Esther says a very necessary supply of equipment. And Ismaila Edego, the issue of immunization coverage as related to immunization target is also a thing of concern. So we must be wary. Believe it or not, we are almost at the end of this event. And I'd like to turn back to Charlotte. I think we have many hands raised in the room. Would be lovely. Is there another challenge that you'd like to invite the challenge owner to present, or should we go to the folks with raised hands and hear some final parting thoughts? I do want to highlight this special event is the beginning of a process. It's part of the launch, and it's our contribution to the launch of Immunization Agenda. Charlotte, what are your thoughts? What should we do with the final minutes of this event?
Really, Reda, we still have so many challenge owners that are actually lined up and expecting, to be given the opportunity to express themselves. So many raised hands and so many comments on the chat. I would like to turn to Dr. Salaj Rana from India. Reda, while you're putting up his slide, there is a comment in the chat I want to read from Gloria Sereko that says immunization champions at all levels, but most importantly at local level. May we identify them, may we be them, and may we work with them. So thank you, Gloria, for that comment. I thought it was essential for me to share with all those who are here with us today. So Dr. Salash?
Yes.
Okay, so over to you, and want to apologize if other challenge owners are here and they may not be able to share. But I think, Reda, we could think of something to get all of these challenges to be shared.
Certainly, yes. We'll be sharing the full deck with everyone who attended the event. And as I said, this is only the beginning, the first event. I'll be actually sharing in a couple of minutes. Before we close, I'll share with you what is the next event that is on our agenda and that we hope you'll be a part of as well. But first, let's hear from Dr. Salaj Rana, Dr. Rana, you listed a number of immunization challenges and linked them specifically to COVID-19 epidemic. You are from India. We, of course, would especially love to hear more.
Thank you so much, Reda, for the opportunity. And myself, Dr. Salaj Rana, I am from Indian Council of Medical Research in Ministry of Health, India. And our organization has a mandate for the research and the funding part. And related to the immunization challenges due to the COVID-19 pandemic. So we all know during the pandemic, field activities in the countries was hit due to the apprehension of the beneficiaries and the increased work pressure of the healthcare workers also. The field visits got stopped and the training to the healthcare providers could not happen. So we have arranged the VCs type of things with the centers, with the PSC and SCs. Implementation of the immunization program was also not on high priority by the district, state, and the nation at that time. Also, all the healthcare workers were engaged in the COVID duties. So we supported online training for the healthcare workers in this phase and continued data collection at a pace that that can be done in that difficult situation. So also there was a delay in the obtaining the real-time immunization data, enabling to track out the left outs and the dropouts, capacity building of the healthcare providers, useful data pertaining to the immunization policy making, supporting then the monitoring of that supervision. So that was also difficult, but there was a delay, but anyhow we are managing that also. Securing the trust and the support from the healthcare workers. So that was very difficult from that particular field visits at that time. So that was a challenge for us. And there is a reluctance to use of the various applications by the healthcare workers. In India, there are many platforms working in different states and and there is no such universal application that can collect the immunization data. So there was generally a reluctance. Due to that, there is an increased work burden for the healthcare workers. So in addition to providing the routine care activities for the pregnant mothers and vaccinating children, health workers are maintaining the many records or register for the online data entry or for the same that programs that increases the work burden in the COVID-19 pandemic. So involvement of the healthcare workers was also there. That is the other programs what currently running in the 2020. So that is TB, leprosy, and the NCD survey was also there in that particular time. So timely report submission was not observed, and the data collection of the beneficiaries due to the migration activities, because in pandemic people are running back to their homes. Many of the urban areas that rural people are coming to have their babies and all family live there, but in pandemic they are returning back to their home. So monitoring of that particular due dates was challenging, and different ashas or different areas was interacting, but that was also a challenge due to the limited physical activities. So this was our challenge, but we are highly motivated from, because we have done the VCs, we have done many meetings in the lockdown also, after lockdown, before that particular time. But now India is facing the second peak of the COVID-19 cases. Again, the activities got a little bit stopped. And what we need from this platform, because we are a primary research organization in India, and this activity in the immunization, we have the partners with the BMGF and the WHO also. We are conducting that study. So what we can get from this platform, if three things can be done, that if any inter-countries collaboration can be done with the help of this platform. Any inter-collaborative visits can be done by any country. For example, if we want to understand what is happening in the Nigeria or in the Colombia. So after this pandemic, if any visits can be done in that remote areas, so that will be very helpful for the other countries, professional or other countries, that particular leader who is responsible for the immunization activities in that particular country, to understand the situation better. And if something is coming from that particular area, so they can also implement the same. And if India can help us, India can help the other countries in any way, that most welcome. We are welcome for that. And also from WHO, if inter-collaborative study can done for the research and innovation aspect. So that aspect is very important to attain the Immunization Agenda 2030. Because what I have felt that all the sustainable goals can be achieved for that broader goal, and research and innovation is also a very important part. So for that 2030 agenda, that if we want to achieve, so all the parameters should be on focus, and for that research and innovation and the mass capacity building across the nation can be done. So this is from my side.
All right, thank you very much indeed, Salaj Rana from India, with the immunization challenges due to the COVID-19 pandemic. All right, I believe I'm going to propose that we do something we have never done before, which is extend a special event beyond the allotted time. We usually run a tight ship with Swiss punctuality, but this feels exceptional. This feels, the number of people in the room it has barely gone down. There are actually more people on Facebook than there were in the beginning, as well as on YouTube and LinkedIn. So I'd like to propose, Charlotte, if you accept this proposal, that we extend this event. And would that be acceptable to you, as you are the convener and mistress of ceremonies today?
It's much acceptable to me, Reda. I really want to give the opportunity those who have been listening to get to give their own feedback, to say something about their own challenges, and also maybe listen to one or two challenge owners who are still in the room and really want to have the world listen to what they have to say today.
All right. Now, for those of you who have to leave, I'm just going to give you the announcement for the next big event. So right now, we're the 28th of April. We're contributing to the launch of the Immunization Agenda 2030. Now, the next date on your calendar, you'll be receiving a number of invitations by email. One of them is an invitation to join the secret channel for Immunization Agenda 2030. So you'll receive that invitation. You can check your email, check your inbox on a regular basis. We know we send you a lot of things by email, but we really try to just send things that can help you. Now, what you're seeing on screen here is Teach to Reach Connect 2. So many of you were there on the 26th of March, the first time we organized a pure networking event. So rather than listening to people make presentations or having discussion, it's a unique opportunity to meet, network, and learn with fellow immunization professionals. So it's 58 days from now, but you can already request your invitation right now, and I encourage you to do so. What is it about? We'll be talking about zero-dose communities and how you are reaching them or not, and what you need to do, what action needs to be taken. We'll be talking about COVID-19 vaccine introduction, about missed opportunities for vaccination, topics that are important to you where there is significant global knowledge, and through these networking sessions, you'll be able to exchange, have 5-minute meetings with someone else, another immunization professional who could be from anywhere in the world, and you'll then be able to decide, do you want to share your contact details? Do you want to move to the next networking meeting? And one Teach to Reach Connect participant after the March event actually told us peer learning is the key to professional development and networking is the key to peer learning. So for those of you who have to leave, I did want to share this final announcement with you. And now back to you, Charlotte, for our next challenge and presentation.
So right now I'm going to invite Christopher Tamal, a reader from Ghana. Christopher, please can you unmute yourself and share your challenge with us? So Reda, if you could
yes,
put up.
I see it.
Okay,
yeah. So, all right. So this question had to come up, right?
Yeah.
It is the question of administrative coverage versus coverage results from vaccination coverage surveys. Christopher says, in the northern part of Ghana, administrative coverage for vaccines has often been above 100%. And then when there are independent coverage surveys, the far poorer coverage than the administrative one. And he says quite intriguingly, and looking forward to hearing what he has to say about this intrigue. Many outbreaks of vaccine preventable diseases are recorded in these areas which churn out high administrative coverage. Some hard to reach areas are poorly covered. Christopher, a warm welcome to you. Don't forget to introduce yourself. Tell us who you are, what you do in Ghana, where you work. And then we'd love to hear you take on these questions. I think we understand your challenge. So it's really, what support do you need to tackle this challenge? What are the barriers to make progress? And then that question about, if you're able to imagine yourself 9 years in the future, what's different with respect to how vaccination coverage is measured? That's a lot of questions. Let's go one by one, Christopher, and a warm welcome to you.
Okay, thank you very much, and good afternoon from Ghana. My name is Christopher Tamal, and I'm a field epidemiologist with over 7 years experience in public health practice. I currently work with the WHO Ghana country office with the public health emergencies team. We often provide technical assistance to the government through the Ministry of Health and Ghana Health Service. So as I already alluded to, my problem is consistently high administrative coverages of antigens in the northern part of Ghana. And if you juxtapose that with the survey coverages, that is usually conducted by the Multiple Indicator Cluster Survey and Ghana Demographic Health Survey, you would observe that these surveys rather show low coverages. Again, if you have to look at the trajectory of some of the outbreaks that occur in vaccine preventable diseases, you will notice that many of them do occur in the northern part of Ghana. So the question is, how is that the case that you have high coverages, yet you also record vaccine preventable disease? For instance, in 2008, the last wild polio virus outbreak that occurred in Ghana was actually in the northern part of Ghana. Again, in 2019, when we recorded our circulating vaccine-derived polio type 2, it was first detected in northern Ghana. So these are the issues that raise a lot of questions about the administrative coverages that we receive. So the challenge is a concern to us, especially with those at the WHO, because if you look at the universal health coverage, we have the $3 billion Agenda 2023, which I would say is an ambitious initiative to improve the health of populations by 2030. And in our pillar, which is pillar 2, we try to work on the three prongs or outputs, say preparedness, prevention, and also detection and response. So if you look at the prevention pillar, immunization plays a very critical role in achieving this. And again, the challenge matters to us because we cannot achieve the universal coverage if people are left out of basic healthcare services like immunization. So far, what is been done to address the issue is the development of an data improvement plan, which one of the key elements in that is to train staff in the implementation chain on immunization policy as well as the EPI field guides. And at the district level, we also conduct district-specific coverage studies so that we can validate the kind of data that is churned out. That again, we use operational. We try to encourage the use of operational data as baseline, because if you achieve a more than 100% coverage, it therefore supposes that maybe your base data or your denominator may be short. And sometimes these issues come up of maybe Ghana Statistical Service is the only authorized organization that provides us with data to work with in terms of population dynamics. And some areas, maybe due to one reason or the other, they happen to have lower base populations compared to what is on the ground. So sometimes these things occur, but when you go down there for monitoring and you see this, we always encourage that maybe what you have accomplished this time, maybe the next time that you are planning, plan based on what is really on the ground so that we can use that one to validate whether it has to do with data challenges or something else. Then we try to do a lot of monitoring and supervision at all the levels so that at the grassroots, we are able to provide them with coaching that will help them to overcome. Looking at the support we will require to tackle this challenge, we would much of all need resources for regular monitoring, because if you look at the general trend of issues, people will often want to do what they are supervised to do rather than maybe what they are supposed to do. So if you regularly visit and you provide them with coaching, the support, I think it goes a long way to help them do what has to be done. And again, we're talking about advocacy, letting the people own the data at the levels that they churn them out, so that we all know that vaccines themselves protect and not numbers. So that if you are churning out 101% and at the end of the day, people still get outbreaks in your community, we should be worried. So what will be success like in 2030? We would think success in 2030 will be a joy for all of us, because stakeholders in the health system, especially those at the lower levels who own the immunization programs and work with it. All that is required is concerted effort to monitor and provide supportive supervision. Because if you look at the mainstream of having improved immunization coverage, we have four main elements that should work in tandem. We need a concerted supply chain managers. We need efficient, reliable data for planning. I also need efficient design and distribution of logistics like vaccines and the rest, and continuous improvement, which is the fourth element. So basically, these are the things that I think when we work with it, we'll be able to achieve that coverage that will resonate with the reality on the ground to prevent people from getting outbreaks. Thank you very much. Over.
Thank you very much indeed. All right, there have been more and more comments piling up on the social media platforms and in the Zoom studio. I just want to highlight a couple of them. Let's see, there is, all right, some of you are sending multiple messages. So for example, Gaddafi Ahmed, who's a registered community health nurse in Nigeria, who says she wants to appeal to the government to make this Immunization Agenda 2030 work. because there are a lot of rural areas, especially in Africa, for example, in the Niger Delta, where children are unable to get immunizations. She's working temporarily in a health clinic as a routine immunization in charge, and her major challenge there was poor coverage. Now, Ismaila Edego, responding, I believe, to Christopher Tamal, that has been my main concern when it comes to data at the base level, estimated target data, which may either be lower or higher, as in this case. Hence, working with operational data is key. All right, so thank you very much. We're going to go for 15 more minutes, I believe. I know that some of our guests have had to leave, and that is understandable as we are over time. Charlotte, back to you. What shall we hear next? And of course, if there are comments in the chat that you'd like to highlight, or if you'd like to ask one of the people, we appreciate your patience who've had their hands raised for a long time. Some of them actually don't have their microphones connected, so we definitely won't be able to hear from them. But if there's anyone you'd like to hear from, please I will follow.
Okay, thank you very much, Reda. I want to first of all start with this comment from Anne Lindstrand from WHO, who unfortunately had to leave. She left this message on the chat. She said, "Thank you all, invaluable insights. IA 2030 was developed with thousands of immunization stakeholders like you. It reflects exactly what you are telling today. I am encouraged to hear your analysis and ideas to face our common challenges."
As we're moving towards the necessity of closing this event, I think we maybe should read this again as parting words. What else have you spotted? What else would you like to share?
So many comments read that I'm not sure we'll have enough time to read all of them. So I'll just want to turn to my next presenter, and just to say she's going to be Dr. Madonna Anabieza from the Philippines. So I really wanted us to listen to her today, Reda, and also next we are going to give an opportunity to those who have raised hands to be able to share their thoughts and their insights based on what they have heard today. So right. Over to you, Madonna.
Yeah, thank you and welcome, Madonna. So just to summarize your challenge, it's about low coverage in immunization in a part of the Philippines, an autonomous region in Muslim Mindanao. And this low coverage is, you say, primarily due to vaccine stockouts. Usually the findings we encounter during field and monitoring visits at the rural health units. This is complicated by other problems in inventory of vaccines and logistics, forecasting, as well as in procurement, delivery, and distribution of challenges. So a pile of challenges. We'd love now to hear from you. Again, I think we understand. You feel free to add details about the challenge, but really what we want to know is what support do you need? What are you doing about it? What are the barriers that could prevent you from making progress? And therefore, if these barriers were removed, you might be able to make progress. And then that question about projecting yourself in the future, what does success look like with respect to this challenge that you are facing? So warm welcome to you, Madonna Anabieza from the Philippines. We're all ears.
Hello, good afternoon, good evening, good morning to everyone. So I'm Dr. Madonna Anabieza. So I'm currently the Health and Nutrition Specialist of UNICEF Philippines Mindanao Field Office. So as working for the Mindanao Field Office, so we do a lot of monitoring and field visits. I'm reporting to BARM, which is one of the administrative regions of the Philippines. So Philippines, by the way, is composed of 17 regions. So the stock out problem here is actually very glaring because it usually just happens in this area, no? It in this region only, compared to the other regions of the country. So that's why it is very important. So I think I care about this challenge, of course, because these vaccine stockouts lead to low immunization coverage. And actually, as per the National Demographic Health Survey of 2013, only 29% of children in BARM have received all basic vaccinations. So thus, actually, whenever we have this large measles outbreaks, for example, like what had happened in 2019, where we have around 35,000, almost 35,000 cases of measles in just 5 months in 2019. So, and also We had polio outbreak no, in also in the Philippines, where in fact we had been already declared as polio-free since 2000. So majority of these cases came from barn. So it's because a majority of really of the children are not really being vaccinated. So what am I doing to support the team is actually we are of course advocating no for the because this administrative region is undergoing a transition of the government, so we are advocating for having a team to handle the immunization program, because currently there's only one person who is handling the immunization program, and she has to actually monitor 5 different provinces, which are actually majority of them are hard to reach areas and islands at that. So we also support the conduct of outreach activities in villages and also assist in the provincial and even regional and municipalities in doing proper inventory. And also when able, we also facilitate even the vaccine delivery up to the municipality level. And as of now, we are trying to develop a web-based vaccine stock and supply management for managing their vaccine supplies. So what support do we need to tackle this challenge? Basically, because we would want also to connect this far-flung region of the area of the country to the central government. We would want to have, of course, a support for hardware, software, even internet connection to link the BARM to the national government. And also, of course, human resources from the region down to the province for monitoring and support of municipalities, and of course, healthcare workers in municipalities. But majority of the barriers that we have to make progress is, of course, this area is a conflict area. So sometimes whenever we have invested already something, because of the conflict, it gets destroyed. And of course, we lack resources to support efficient system of inventory distribution and even the delivery of vaccines. Also, there are a lot of political dynamics, especially that, as I've mentioned a while ago, the government is in transition. So what does success look like in 2030 for me? So of course, we would like to have that there's no stockouts, and of course, there's good inventory and management of vaccines to be able to increase the coverage of immunization in this area of the country. So what we need to achieve this progress is, of course, resources, as I've mentioned a while ago, not only funding but also human resources. Also, of course, advocacy for political will and funding to support the improvement of the whole immunization system as a whole. And of course, to sustain this all, we would have also to have peace in this area. So that would be all from my end. Over to you. Thank you.
All right. Thank you very much indeed. And a round of applause for all of the presenters and folks who've made comments online. There's simply too many today to actually acknowledge Charlotte. And I apologize for that. We'll do a rewind. We'll be sharing many of the comments at the end of this event. Where would you like to go next? Should we hear from people in the room? Is there another challenge that would be important to hear from? And again, tell us, do you recognize yourself in these challenges that you've been listening to? What shall we do next, Charlotte?
Okay, thank you, Reda. And just to say, yes, lots and lots of people are identifying themselves with these challenges, and they are actually sharing their own challenges right here in the chat in the Zoom room. So if you are here, please just take a look. No time to go through all of them. I'd like to turn now towards those who have their hands raised.
Yeah, Charlotte, I just want to say, so there is Emanuela Odunze, who I know is very often listening in and participating in our events, and she says there's a challenge to joining the Zoom. She's facing a different kind of challenge, which is to join the event on Zoom. So just to explain, we were overwhelmed. We had room capacity at 500. We knew there were more people registered, but usually not everyone shows up. And today, everyone showed up. So most of you are now on Facebook, YouTube, LinkedIn. Thank you for being there. And apologies if we're not able to make it to the Zoom room. Yes, Charlotte, who shall we hear from first?
So I'll just want to turn to Mohammed Kaba. Your hand has been raised for quite a while now. If you can unmute yourself, we'll be glad to hear from you what you have to share. And I know you are actually...
Hello, can you hear me now?
Yes, we can now.
Yes, we can hear you.
Okay, thank you. I'm sorry for the first. So, false rumors and vaccine hesitancy are the most challenges we face during the vaccination implementation in the field.
Please, Mohammed, can you start by introducing yourself? Tell us who you are, where you work, what you do.
Sorry, I'm Dr. Kaba. I'm based in Dakar, in charge of COVID-19 vaccine deployment and implementation in the West and Central Africa countries. I'm deeply involved in vaccine in the state of emergency use listing. So the challenges that we face during the vaccine implementation in the field are the false rumors. These false rumors can negatively impact on the research implementation in the field. It can cause reluctance and hesitance among participants. So the best strategies are focus on the communication at all levels, starting from the highest level to the community. So before starting any vaccinations, you have to gather around participants and then explain the pros and cons, all the information related to the vaccine before vaccination, and then listen to them carefully because they are going to explain their worries. After explaining, try to address their worries. And also, I highlight political involvement in the vaccination process. Political involvement can help me to the process of the research. So far, lessons learned, the involvement at all the levels in the coordination and planning process, strong communication strategies, and also the availability of the cold chains and logistics. Over to you. Thank you.
Thank you very much indeed, Mohamed Kaba from Senegal. And we hope you'll also be with us for tomorrow's event with the Francophones. And we're working on, we would really like to have all countries together without the barrier of language, but we are holding a separate event. So the French language event is also taking place tomorrow. Charlotte, back to you.
Yes, Reda, I just want to invite Mohammed Imran Qureshi, that's a team leader for the COVID-19 peer community in Pakistan. Mohammed, your hand has been raised for quite a while. I really want to hear, what do you think about all of these challenges that have been presented today? And from your own perspective,
can you hear me?
Yes, Mohammed, over.
Thank you very much for providing this opportunity. I'm highly excited to start yet another journey of scholar courses. And I'm so pleased to see the colleagues from national level, from the provincial level, and even the district level. First of all, my introduction, I'm Dr. Mohammed Imran Qureshi, working as technical officer in EPI WHO Punjab and supporting country group of Pakistan as country team lead. So the exciting agenda is right there, which is the immunization agenda and future of immunization in the world. So the challenges which Pakistan is facing these days, like I must say, the challenges are like numerous challenges of urban immunization. You could see challenges of inequities, challenges in our service delivery, challenges of left outs, dropouts, missed opportunities, and vaccine stockouts. And we could also say that there are like coordination and collaboration challenges. Demand generation aspects has certain challenges. Vaccine hesitancy is like an evolving subject in the country. So there could be like many more challenges, but the way forward is quite obvious that together we can like not only sustain the gain, in the current COVID context where we are like losing so many achievements. So we are really looking forward towards a universal immunization goal. Thanks to the government of Pakistan, which is quite motivated in their oversight and ownership. All the partners and donors, they are already there, and their support is quite evident to achieve all the universal immunization goals and objectives. So the pathway is quite clear that by 2030, where I'm looking Pakistan as far as immunization is concerned, I believe that a lot of progress has already been achieved. Like we already achieved 91% FIC in Punjab. But I believe that by the end of 2030, despite of all these challenges, despite of all the hurdles and limitations, but since, as I already told, that there are a lot of opportunities and resources already available, so I believe that by 2030, we will be achieving universal immunization coverage and will be going for 100% FIC for the children of Pakistan. Thank you for providing this wonderful opportunity, and thanks to the Geneva Learning Foundation. Over.
Thank you very much indeed, Mohammed Imran Qureshi from Pakistan, a long-time scholar. We are now at the 30 minutes overtime. We decided to extend. We have never done that before, but this is really in response to the exceptional level of engagement, enthusiasm around this event, and around really a discussion that begins with the challenges faced by immunization professionals who are doing the work of delivering vaccines every day. So before we close, I do want to say that if this leaves you thirsting for more, well, us too. And this special event for Immunization Agenda 2030 is only the beginning. You are going to receive several invitations. I want to cover them now. First of all, for those of you who are reading carefully the emails you receive from us, you already know that there is a secret channel for leaders who want to take forward Immunization Agenda 2030 in their countries. This is a secret Telegram channel, and we'll be sharing some opportunities, events that will be only shared with the Telegram channel. So for people who registered for this event, so I guess it's no longer really a secret anymore. Second, on Sunday evening, and I'd like to really commend the team leaders from Ghana and Cameroon, Martha Ngoe and David Asomaning, respectively. David is from Ghana, Martha is from Cameroon. The Ghana team of alumni from the COVID-19 Peer Hub, the COVID-19 Peer Hub team that thousands of immunization professionals created last year together. The Ghana team has invited the team from Cameroon. Why? To share about COVID, to share their experience of COVID-19 vaccine introduction. As you know, Ghana was, together with Ivory Coast, the first country to officially receive a delivery of the COVAX vaccine from the Gavi COVAX program. And the Ghana team now has experience. And on Sunday evening, this is the invitation you're going to receive only by email. It is not an open event, so look for it. Because you registered and attended this event, you'll be receiving that invitation. And then third, last but not least, is actually something that is right now, as you can see, 57 days, 23 hours, 57 minutes, and 6 seconds away. But it is a unique opportunity to meet, network, and learn with fellow immunization professionals. So this is one of the formats where you can listen and you can share some comments and so on, but Teach to Reach Connect is different. It is a networking event. So what actually happens, you connect to the platform, you press a button, and instantly you're connected one-to-one in a private meeting with another immunization professional who could be from anywhere in the world. And then you have 5 minutes to talk about a topic that matters to both of you. So it could be zero-dose communities. It could be COVID-19 vaccine introduction. It could be epidemic response to another epidemic that is of concern to both of you. You choose, you focus again on your needs. And as one of the participants, this will be the second time we're doing it. The first time was on the 26th of March. We had a participant who summed it up. He said, or she said, peer learning is the key to professional development and networking is the key to peer learning. So that is on Friday, the 25th of June. And that is the next big event. But if you, on Sunday evening, you'll be invited by the Ghana team to listen in on the exchange on COVID-19 vaccine introduction, and then if you join the secret channel, you'll be receiving many other opportunities. We don't announce everything by email. In many cases, you have to be following us on Facebook or LinkedIn or YouTube in order to make sure you don't miss any of the upcoming opportunities. That is it for today. I want to thank Charlotte. Charlotte, I asked you what you were feeling at the beginning of this event. What are you feeling now?
Reda, I was feeling excited at the beginning, and I'm actually feeling more excited now. But before I say a closing word, I really wanted to read this message from Robin Nandy from UNICEF, who had to also leave the room. He said, and I really want to read this message especially for our social media audience. Said, dear colleagues, I'm afraid I'll have to sign off now as well. I'd like to add to Anne's thanks to you all for your enthusiasm and effort on furthering the immunization agenda. With such commitment, I am confident that we can achieve the goals of IA 2030. Two quick comments. One, request all of you to characterize the kind of communities where most of the unvaccinated zero-dose children are clustered and tailor services accordingly. If we can get better at adapting service delivery in remote, rural, urban, slum, and conflicted communities, we will make gains. Two, let's be mindful on the importance of convenient and high quality services in enhancing trust in vaccines and also primary health care, and delivered by well-informed workforce, which you all embody. Thanks all, and thank you very much to you, Reda. Thanks to all those who accepted to share their challenge stories today, and thanks to the wonderful audience on Facebook, Twitter, LinkedIn, and YouTube.
Wonderful. Thank you so much, Charlotte and Boo. Ladies and gentlemen, I'd like to ask for a round of applause for her. She has worked with all of the presenters you heard today, has been in touch with so many of you. I'd like to thank also the team leaders, the Teach to Reach Organizing Committee, the Global Council of Learning Leaders for Immunization. All of you have helped make this event happen today in some way. And we're now going to do a kind of rewind of the many messages. We're going to be able to acknowledge a few more of them. So if you can stay, if you want to stay connected and see what people have been saying on social media, and look for those email invitations. Sunday evening, the inter-country exchange on COVID-19 vaccine introduction between Ghana and Cameroon. And then the other events that I mentioned will all be shared by email invitation, as well as the secret channel for Immunization Agenda. Global partners have been talking about building a movement. So really that commitment that goes above and beyond what you're asked to do simply to do your day job, to actually make a difference, so that by 2030, perhaps we'll have a meeting like this again and we'll be able to take stock of what in fact has been achieved. Once again, thank you. And it's not goodbye, it is see you soon. I must say I love this message from Ukeme Ifeomia, who says, thank you all, I love you all. Ukeme from Nigeria, we love you too.